8:21 right now. Welcome back. Masks in schools. Pennsylvania's Republican legislature strongly feels that that's a decision best left for school boards or parents, but not the government. Can they do anything about it, though, now that the Secretary of Health has issued her order? Joining us this morning on the Fox 43 Capitol Beat is State Senator Scott Martin of Lancaster County. He is the Senate Education Chairperson. Senator Martin, thank you so much for joining us this morning.
Hey, thank you for having me. It's great to be back.
Yeah, so what's next in this? We know that there's an emergency injunction filed in state court. What do Republicans have planned legislatively when you return to session in 2 weeks?
Well, there'll be a couple things. First and foremost, you're going to see a disagreement over what her powers actually are. If you recall, the voters amended the emergency declaration process back on May 18th. The governor chose not to declare an emergency. What he chose to do is to claim powers under the Disease Prevention and Control Act, which throughout that act really references the sick, it references patients. It really doesn't reference the general population. And the reason why, for multiple things, this is really important, is twofold. One is he spent the summer and very intensely throughout most of the month of August touting that local control would be there. He was talking about, what the conditions were on the ground, what the vaccination rates were in that area, whatever it might be. And there were very contentious meetings. And, obviously they had the rug pulled out from under them with a lot of work that they put into their health and safety plans. The second part about this, which is really critical, is are we saying as a state, if the Secretary of Health, who is unelected, and in this case isn't even a confirmed secretary, has the power to implement restrictions on the general population, and right now it's just on school children that they claim they have. If this holds up, what's to say that they don't have the power then to shut down businesses again through this mechanism, or to quarantine individuals that aren't sick necessarily?
I guess what I'm wondering is, is this all come down to how you determine or figure out what the wording is of this 1955 law? Because, it seems like it pretty clearly states under the state law that was passed by the legislature back in 1955 that she has the powers to do this.
Again, we believe she has the power in the theme of the whole Disease Prevention Act in its entirety really is focused on sick individuals, on patients. However, this really, if we're now going to act as if we're an emergency without declaring an emergency, which the voters wanted checks and balances in and account. Remember, the governor could have declared an emergency. Nothing prevented him from doing that. He would have had to work with the General Assembly within that 21-day period to share data and the evidence. But instead, he chose to go that route and now claim that he has power solely under this. So there's a lot of constitutional and power-related issues that need to be settled from a court perspective.
And the court will see that. And I think the court will see that in a couple of weeks, at least with the emergency injunction that was filed. I do want to move on. What do you think the legislature's role should be in protecting the health and safety of school children?
Well, I think everyone, first and foremost, there is nobody better suited to see what's in the best interest of their child than a parent. And so the rights of parents always have to be protected. Secondarily, it's our job to ensure that powers that are exercised in a state of emergency are done within the confines of the law. Are they based in science? Are their efforts being transparent? Are they consistently applied? And that's what the people really wanted to implement here. And if they're not, and are not being fair, and we can probably talk all day over the course of the last 18 months, things that should have been done differently, it's our job to be able to hold the governor or those implementing this emergency accountable to that. And that's what my constituents expect us to be able to do. If they truly feel that this was an emergency that required this action, and to this point, he's only really required it on his state employees underneath him and our school children, nowhere else across the population, then he should be able to provide the justification for that, show us the data, show us the science, show us the stats, do it under the emergency.
Do you believe that masks are effective or ineffective then in protecting unvaccinated people against COVID-19?
Well, quite frankly, what I'll say is if you look even at the data that's coming out of our schools that's being collected over the last week between schools that had mask mandates and schools that did not have mask mandates, that were mask optionals, the stats look exactly the same. They were still having testing for positive cases under both scenarios. So there is plenty of concern out there on the impact of kids and their development. There's concern over those who have issues with having to read lips and do other things. And it's very hard for families to actually exercise their right to even get a medical exemption. So nothing stopped the family from sending their child to school with a mask and wearing a mask all day long. What most school districts had done was allowed parents who didn't want it to exercise that option too. And it seemed like everyone, for the most part, obviously the governor was under a lot of pressure from various special interests to put this in place for everybody. But I really believe what the school districts did and the work they put into coming up with health and safety plans was very legitimate, well thought out of. It listened to the community and their perspectives, but then he did it at about face and pulled the rug out from underneath them.
You have expressed interest in running for governor, and I'm wondering if you've made that decision yet. Will you?
I have a couple more weeks. We've been crisscrossing the state over the course of the entire summer. The feedback's been great, talking about the future of Pennsylvania, and we have so many opportunities. I'm an optimist. I think we can do so much better to really turn around a lot of our population trends, which have really been lagging. We're losing another congressional seat, and really grow our economy for more family-sustaining jobs, and also have better education opportunities for our kids. So it's been great over the next couple of weeks, Matt, to formally, sit down with those who have been advising me, and also my wife and kids, which is probably most important, and make a final decision.
And we have about 30 seconds left, so I want to get you out of here on this, and I wish we had more time to talk. But with that in mind, of you possibly running for governor, I wanted to ask you about what recently happened in Texas and their ban on abortions after 6 weeks. Women's rights leaders say this is incredibly restrictive in terms of abortion laws. Would you support a bill like that in Pennsylvania if you were governor?
Well, listen, I'm a pro-life legislator. I've been a pro-life all my life in my years of public service. I was the author of the Down Syndrome Protection Act and have voted on other things to restrict or rein in how lenient abortion access is in the Commonwealth. What you're referencing, what Texas in essence did, was a heartbeat bill, which some have pushed in Pennsylvania. Listen, I believe that's a life. I believe that's a life that is lost when a child is aborted. And the more that science shows us their ability to feel pain or when the heartbeat begins, we need to absolutely do all we can to protect them. And I will never back away from that.
State Senator Scott Martin of Lancaster County, thank you so much for joining us this morning on the Fox 43 Capital B. We got to do this again. We have to do it in podcast form because there's so much more that I'd love to talk about with you. So we'll do this again pretty soon. Thank you, sir.
Anytime, Matt. Thanks for having me.
Yep, we'll be right back with more Fox 43 Morning News.